Well, it's very friendly. I think that one of the things that impressed me is the ambiance of the facility. You come in, there's no odor. It doesn't seem like an old folks home. And they have, well, the player piano, plus people can play on it. It just doesn't give you a feeling like you're in an old folks home. And the reason that I came here really was because of the rehab. They have excellent rehab.
Well, I came in not walking. I had back surgery, and I was very weak, and within 4 weeks, look at me.
When we got here, my mother was not able to move at all. She wasn't able to walk. She was able to use her arms however she needed to, but anything she needed to do, any motion she needed to make using her legs, she was unable to do, but on her own. My mother is now, after just about 3 weeks, better able to function than she was prior to this accident. She's walking much better, much more quickly, with much more confidence. And because of the work that the therapists did with strengthening her arms, her thighs, her back, she's much more mobile. And she's functioning in a way she hasn't for probably about 10 or 15 years.
They work with it. They take the notes, follow up, and that's important.
Well, we were given a choice of 5 different places, and I didn't really know that much about this place, but since it was recommended by my doctor, I thought I'd take his advice. So I think I lucked out.
For me, it's been a very fulfilling experience. In some way, you know, even though I really would rather not have to be here or anywhere like this, when you think about it, when I think about it, I've been very lucky in that I found a good place. It really fits my skills.
What I like most about Edgewater is the friendliness of the people who work here. They're pleasant to each other and they're very kind to their patients. And I greatly admire the people in the therapy department. I think they are just outstanding.
There's all different kind of places like this. But when you fall into this place, it's different because it's very homey.
When I got here, I was very unhappy, and but they tried everything to get me what I wanted, and they did, and they were very nice. And I have to say that the therapy people are wonderful, and the nurses are great, you know, the aides. It's really been nice here. Maria gives us she makes good coffee.
I mean, like the candlelight dinner, that type of example that you saw down there, I've never been in a place where they had anything like that. And daily activities, they have activities in the morning, then they have lunch, and then they clear the lunch, and then they have activities in the afternoon. There's TVs up there, they watch TV in the afternoon. They'll play bingo, or they can do hobbies. They can come out and do coloring books, and you know, whatever they want to do. But they're up, they're active. They're not just all laying in bed, you know, vegetating.
I have to be one of the lucky ones. I'm still mobile, and I can get out when I want to go. And if people had a place to come to, I suggest this place. I've been to 2 of them. This is the best one.
It's not a cold place. Like some places you go to, it's just so regimental, it seems like, or something. Like I said, they were friends here. They would bring me things in, you know, and some of the workers, and they just made it really nice.
I'm really pleased with the progress, and I think I'll be going home pretty soon. And I think I'll go home without a walker, probably without a cane, and I'll be able to do my stairs that I need to do in my home, and many of the things in the kitchen that I want to do.
My in-laws have been here going on 6 years, and we feel it's a perfect place. They are welcoming, they're warm, they're loving. They are clean.
I definitely feel closer to the staff here. She likes it here. She doesn't speak anymore, but she does say that she likes it here and that people treat her nice. And when I see the staff, they smile, they have time to talk, they don't look, overrun and worn out, and it just makes a big difference.
The idea was to get up and start exercising. Well, I didn't have any feeling in my legs, hardly. I had none in my arm. And I said, well, if I'm going to either lay here and feel sorry for myself, or get up and take a look around, see what's going on here. And I let all the nurses know that, look, I wasn't looking for anything special. No special service. All I was looking for is a way to get out of here, to get well. And sure enough, the care that I received from the group here, and the administrative staff, and the nurses and so on, and the rehab people, the occupational therapists and the physical therapists, worked out beautifully.
If you assert yourself a little bit, and this is not true of me, it's true of anybody, you can do a lot with what you got here. You can really not lose physically or mentally if you just apply yourself a little bit. And I think that many, many places don't allow you to do that.
Well, they've been excellent with him, and we both have agreed, even though he would like to be home, he would not have the level of therapy at home that he could get here on a daily basis. And they worked very hard with him, and we definitely have been able to see progress. They're very helpful as far as trying to make sure he's not doing too much, but doing enough, and encouraging him to push a little bit harder if he can. They're just really supportive, and they seem to be doing a great job. His is going to be a while. It's going to be very slow, but we've already seen good improvement already.
Frankly, I didn't know anything about any of these facilities, and I went by the one my doctor recommended, the surgeon, and he recommended more than one. He didn't know that much about this one, but he'd heard good things, and I decided to try it.
My one daughter comes every day, and one daughter comes every other week, and we have a family picnic out here on the patio, and my little grandkids love it, and they come here, and they enjoy coming through here, and it is really a lovely place. It really is. There's no question. And if, God forbid, I ever have to come back again, I would come here.
It's worked out very well. It's, the staff is very pleasant and caring. They really do care about you, and they're cheerful and pleasant, and the surroundings are very pleasant as well.
Well, they're very caring. This place is really good. They keep it very, very clean. There's no complaints there. And like I say, everything is good. Your needs are here. Whatever we need, we get.
Well, I think it's the fact that administration is taking care of their role, making sure that they have good staff, they have people that can come to them. They're working together. They're not selfish with their smiles. And that's important.
The biggest thing is an attitude. Your mind controls an awful lot. And if you're open-minded and willing to learn and work with them, I think that they'll really benefit. So just don't be afraid.
I really thought I would never walk. I am now up walking without any assistance from anything.
And I try to come back even though I'm not here any longer. I come back for visits, to let them know, look, there's a life out there for you. Get with it and keep working.
It takes a special person to do this type of work, and it really takes a calling, and so I think to do it and for the level of care they give here, they really